Hi guys, welcome back to Dr. Shane's channel. How are you today? I've been doing one and two videos on just medical topics and speaking about them and having friends come on and having conversations with them. But I felt like today we just have a talk of why I became a doctor, why I wanted to do medicine. During primary prep school and then going into high school, didn't really have much aspirations of being a doctor at that time. I guess I've always wanted to do the sciences, yes, but wasn't necessarily to be a medical doctor. I think that came up more in the latter part of high school. And it also had a lot to do with my grandma when she got sick. My grandmother unfortunately had breast cancer, and I witnessed her going through that battle and that struggle of going through breast cancer and what the surgical aspect entailed, the radiation chemotherapy aspect entailed, and the stress that that took on her. And it was almost at that young age realizing or seeing her go through that traumatic experience that made me think, there must be another way, or there must be a way to help people more, or to guide people, whatever conditions that they may have, to give them a better chance or to help them through it. So that was where my real sense of wanting to become a medical doctor came from, was actually just from my grandma. And watching, it was hard, it was very hard actually. But it was a process, and it was a process that I learned from. So from there, focus more on the sciences, which for medicine is really just for you to make sure you have your chemistry, biology, and physics. Did that up to a CAPE level. For CAPE, you didn't necessarily have to have the physics, but definitely the chemistry and the biology. And then from there, went into medical school. Medical school was long. It's 5 years of full-on medicine. 2 years of having more so in hospital, not in hospital, in classroom classes, going back and forth with classes, almost like a regular high school type class or university type class. And then after those 2 years, you go straight into, which was my last holiday. That's the only time that you got to really have your last summer, true good 2.5 summer holiday, which I miss. And then from there you go into another 3.5 years of practical medicine along with theoretical, where you're actually interacting with patients, getting to see surgeries, getting to assist in operation, getting to do examinations on patients, learn how to take bloods, learn how to do a history, to understand and get the whole senior authority in terms of senior doctors, their perspective, and understanding that it's not just what you read about, but when you actually are in front of that patient, you also have to now think practically. What best helps this patient for this situation? What's the best form of treatment or the best way of examination to assist and guide this patient? Yes, we're going to read about all the examinations that we've done, the processes of how you should do it, and what the book says is the stuff to look for the diagnosis. And yes, don't get me wrong, there are certain diagnoses that you actually see the patient coming with these exact symptoms. When you look, you're like, yes, they have this, they have that. It's definitely this. So when you probably don't even have to do the necessary tests, which you do anyway. But when the tests come back, it confirms what you already thought the patient has, which kind of confirms in your mind that you were correct, and which kind of gives you that sense of, yes, I'm doing the right thing. But you also learn that when seeing the patients, you find that you have to treat the patient for the patient. It's not just about what you read about. You have to kind of at times tweak how you manage a patient and how you treat a patient. Going through med school taught me a lot about being patient, taught me a lot about interacting with other personalities, people, how sometimes it's just better to keep quiet and listen and say nothing at all. If necessary, you may want to react to defend yourself or not defend yourself, or to voice your opinion, to know when to talk, when not to talk. But overall, medical school was enjoyable. You got to meet friends and have friends that you and them are diehard friends. It was a very good experience. I'm happy I went through medical school, and I'm happy that I am a successful doctor. And I've enjoyed it just fine, and I look to further experiences with it. So for people who want to go into medical school or would like to do medicine, it depends on where you are, which region you are, which country you are in. Every school has, or continent has different criterias for you. For some places, you have to do pre-medicine before you go into medicine. So it depends. What I would say that you definitely need to ensure that you have is one, the discipline and the dedication that this is what you want to do. Two, to go into medicine, you have to want to focus. It's a long process, but it can be an enjoyable process. And you have to ensure that you're disciplined and you're focused, because it's a lot of information. It's a lot of work that can just fly over your head if you don't sit down and plan it out properly. Always in your courses, try to stay ahead of the game. To get in, your grades have to be good. If you can get a scholarship, that's a very, very good thing, because med school or medical school is expensive. So it's good to have some form of financial aid. And if you have to have a financial aid plus a student loan, then I ensure that once you start to work, that student loan becomes your main priority to pay off, and always pay on the principal and get it out of the way same time. You have to do the sciences to get into medicine. So you have to do biology, you have to do chemistry, and whatever other prerequisites, you have to be fluent in whatever language your native country is in, whatever other prerequisite that your medical school may need. Overall, it's just to really sit down, be focused, be disciplined. As long as it's what you want to do, then go for it. So thank you guys for listening to me on that, and do have a great day. Like and subscribe.